The Myeloma UK Infoline is a quality accredited freephone helpline. Anyone can call the Infoline, friends, families, patients, anyone with anything associated with myeloma or related disorders such as plasmacytoma, amyloidosis or MGUS. The Myeloma Infoline is answered by myself and by Maggie. We're the myeloma information specialists here at Myeloma UK. If both Maggie and I are on a call or we're unavailable, then one of the services team will take a message, and again we will call you back as soon as we possibly can. I am a registered nurse. I've been a registered nurse for many years. I previously did work in the clinical situation. I did most of my training here in Edinburgh in the Royal Infirmary. I also did further training and I have a diploma in cancer and palliative care, as well as courses in cognitive behavioural therapy. The Myeloma Infoline provides a listening ear. We also provide information and support. So should someone call us for the first time, I quite often say, will I send you one of our information packs? So by the end of the call, I like to recap, make sure that I've answered all the questions that have been asked, if I possibly can, and also suggested other resources for them that I could possibly send out by post. We can't give medical advice on the Myeloma Infoline, and we can't prescribe, for instance. We can't tell you to change the dosage or the way you take your medication. We can comment on some of the symptoms and the complications you're experiencing. For instance, not many patients are told that the steroid dexamethasone, for instance, can cause you to be very irritable and to have mood swings. And to hear that this is a fairly common side effect quite often allays people's fears and it reduces their anxiety. We would rather refer back to the haematologist, and we can often suggest questions, the best questions to ask your haematologist for the problems that you're facing. We never know what we're going to get when we pick up the Infoline. It could be anyone, as I say, it could be someone who's newly diagnosed and very scared and very upset. They've never heard the word myeloma before, and they don't know what it is. Some people get confused with the skin cancer, melanoma. We get patients who have had lots of different treatments and they're perhaps beginning to relapse again. So obviously this is another scary time for them, and it can be overwhelming, wondering what treatment options are available, what happens next, and they're often faced with the same fears that they were when they were first diagnosed again. We are a listening ear, so if anyone's upset or angry, and this happens quite commonly, then we can listen and suggest solutions, and quite often by the end of the call I often say, well, you've got a few things to be doing, you've got your healthcare professional to call, you've got this to arrange, you've got this to organise. So I would like to think it allows people to order their thoughts and come to some sort of solution about their concerns. If you call and it's out with hours, out with Monday to Friday 9 till 5, leave a message and we will get back to you as soon as we possibly can. Of course, if your question is on an urgent medical matter, then we would suggest that you speak to either NHS Direct or NHS 24. And these references are on the message on our answer machine. The Myeloma Infoline is free to call from UK landlines. Some mobile providers do charge, but please do check this. The Myeloma Infoline is open Monday to Friday 9 till 5, and we're closed weekends and most public holidays. A call can last anything from just a few minutes to over half an hour. If patients are newly diagnosed and they're perhaps not quite ready to talk about it yet, all they want is an information pack, that's absolutely fine. I can take their details, send them off a pack, and remind them if it throws up any further questions, they can always call me back. There are no time limits to the calls, and I often encourage people to try and open up if I possibly can. So the call can sometimes go on for 30, 40 minutes, but that's absolutely fine. That's what we're there for. We've had quite a lot of feedback about the myeloma infoline, of course, and we do continually monitor it. And some of the feedback has been very positive. The myeloma infoline, in my experience, is a very, very valuable resource, and patients often say that. I know it can be quite daunting to pick up the phone to begin with, but I would like to think that by the time the call has ended, patients and family members, our anxiety is reduced and they feel glad that they've picked up the phone.